Basically kind of a little bit of a review. I think it's related to this issue of quality. Tend to think of, I think it's described in the past, three different versions of AI. When I went to college, what I knew about AI was really related to if-then statements. Effectively, you get a group of people, of experts in a room, you find out how things should work, and then you incorporate that logic into a computer system and make it happen. That's not what people tend to be thinking about when they talk about AI today, but that's when I first heard the term of AI. That's what people tended to talk about. In terms of mental health, mental health is a tricky field. Mental health has a lot of nuance to it. And part of what we want to do is we want to basically provide it to the mental health provider in the right context, in the right way, so it supports their function, it supports what they do. And it's not going to, one of the things about these technologies is, and it doesn't take the place of being a clinician. You still need the clinician to make the ultimate decisions what needs to be done. But as much as possible, if it can take away the rote work, the simple work, the things like some of the coding needs to be done, some of the documentation, then effectively, if it can be smart enough for that, then it doesn't become better than the clinician. It makes the clinician better. It becomes. I'd like to think of the AI as being almost like a student who's very smart and supportive, but sometimes gets things wrong. And how can you use that student to really do the work for you and help you in a way where they make you more efficient, they make you better at it, they help you think of things you may not have thought of, but you don't expect perfection out of them. And that's kind of the aspect of generative AI that I think people need to consider.